executive lead of BC's immunization program. Dr. Ballem is, of course, an outstanding health professional and leader and has done, I think, an extraordinary job in leading our immunization campaign and our immunization program in BC, one of the most successful immunization programs in the world. As part of today's briefing, we'll be providing an update on the next phase of our immunization plan as we prepare for the fall. People in BC have demonstrated a true commitment to protecting themselves, their loved ones, and community throughout the pandemic by observing public health measures and getting vaccinated in record numbers. It's important to recall that 94% of British Columbians, 94%, have received their first dose immunization from COVID-19. And every time, I want to acknowledge and thank every British Columbian who, when they've been invited to get vaccinated, have got vaccinated and protected themselves and their community. These efforts have saved lives. Not a few lives, not 10 lives, but thousands of lives. And of course, around the world, vaccination has saved many, many more than that. Our number one priority is, was, and will be protecting people, especially those at the highest risk of severe illness or death. That is why BC has followed advice from public health since day one and has implemented measures to protect those living in long-term care, elderly populations, and those who are clinically extremely vulnerable, ensured that these groups of people were and are prioritized for vaccination. Equally as important is protecting our healthcare system capacity. This means ensuring our healthcare workers receive priority access to vaccines to protect themselves and those they provide care for, and reducing pressure on our healthcare system through a robust vaccination program and appropriate public health measures based on the best available evidence. I am proud that in British Columbia, unlike anywhere else in North America, 100% of our healthcare system workers are vaccinated with a primary series of COVID-19 vaccines. We also want to keep our communities safe and bring people back together safely. Thanks to people getting vaccinated in record numbers, we were able to lift social restrictions earlier this year. We continue our work to reduce the impact of this pandemic, protecting our health and our health system. Now is the time to continue this momentum and prepare for the fall. These are and will continue to be, as we continue to live in this pandemic, challenging times, challenging for our healthcare system and challenging for people around BC. We've gone through multiple phases and together implemented different strategies to address COVID-19 while protecting critical social interactions. It's why in BC, and we can be proud of this, all of us can be proud of this, we kept schools open when others closed them, because the health and social implications for children were so important. And we're going to continue, as we deal with the present circumstances of COVID-19, to do the same thing. And with that, it's my honor to invite Dr. Martin Lavoie to provide further details on vaccinations to date and the science guiding our decisions.
Thank you, Minister. Good afternoon. So my name is Dr. Martin Lavoie. I'm the acting Provincial Health Officer in BC. I would also like to acknowledge that we're here, gathered here today on the land, the traditional territories of the Musqueam, Squamish, and the Tsleil-Waututh First Nations people. So I'll repeat that our first priority is and continues to be to protect people, and especially those at highest risk of severe illness and death. And as the Minister mentioned, continues to protect, we want to protect the healthcare system, its capacity, and protect everybody in our communities as well. But we also want to bring people back together safely. So, since the beginning of this pandemic, public health, we've been keeping our eyes on a number of key factors. And these factors were actually helping us, guiding us in terms of all the recommendations that were made, and also to guide our actions, all the actions that we took to actually manage this pandemic. So these various factors include, among many, a number of things. So we initially, if you remember, we were looking at the interval between the first 2 doses. We also are continue to be looking at those new variants of concerns that keep popping up and their transmissibility, how infectious they are. We also look at all the different types of vaccines that we have available for COVID-19. We look at outbreaks, we look at cases, infections, breakthrough infections. We also look obviously at what happens in the rest of this country, but also around the world. It's a global pandemic. We look at case rates, the number of cases, how that evolves, and we also look at what happens with hospitalizations. So this work has and continues to be very important, and we will continue to keep our eyes on all these things, and we will continue to adapt as the pandemic is evolving. So as you can see partly here on this graph, the number of deaths and the number of hospitalizations have decreased significantly a number of times, and even more recently. And so we can see that here. And they have dropped significantly from those peaks that we see to much lower levels. Vaccination has made a huge difference to be able to get us there and drop the number of cases, hospitalizations, and deaths. So we need to continue on that trend. We're in a much better position now, and it means that we need to be all up to date with all the doses that are recommended in our particular situations. Unfortunately, we know that there's also about 1.3 million people who have not yet received their booster dose. So being fully immunized with all the doses that are recommended is very important, because we know that it makes a huge difference, provides excellent protection, and it makes a big difference in terms of what we see month over month. So over the last few weeks, as you may have heard, we have seen an increase in the number of cases being hospitalized. So we are keeping our eyes on that. The virus continues to circulate, so we want to be clear, the pandemic is not over, unfortunately, and we are seeing the number of cases and number of people ending up in hospital go up and down, and we will continue to see that, and that is expected. We saw, and this graph here is actually showing, so what we saw in the last 6 months or so is Omicron. Omicron slowly going through and spreading in our communities. In the winter, it was Omicron, one of the siblings, if you will, Omicron BA1, and it came in, and over time, after a few months, it started to be replaced with another sibling, another Omicron BA2, and BA2 took over. BA1 disappeared pretty much, not completely, and that's what we saw in the spring, so just a few weeks ago. And this is what Omicron is doing. Again, it looks like we're seeing an increase in BA5, as you probably heard, and we are seeing that. So same pattern for Omicron, as one of the siblings, if you will, of Omicron is taking over, and we are going and continue to go through a similar process. We are in a good place. We did quite well, not perfectly, but we did very well actually during the first 2 waves of Omicron, and this is what we are seeing now. So we're keeping our eyes on that. We expect BA5 will probably become the majority of those viruses that we're seeing. So when we look at the number of cases of serious disease, particularly hospitalizations, so we see that the most at risk, those at highest risk actually of getting severe disease, is by far those who are 80 years of age and older. We see also, but much lower risk, but still elevated risk, but much behind the 80 years and over, the group that is 70 to 79. So these age groups are those driving what we see in hospital. So these are the ones most at risk of severe disease and most at risk of being hospitalized. said in the data that we're showing, it shows how important it is to be vaccinated. And so for this particular group of people, those at highest risk or at higher risk, we are recommending, as you know, a second booster, a spring booster. And that is to help them maintain a high level of protection that they are not able to maintain otherwise with just one booster. So this is a particular group for which we have recommended a second booster. And actually a lot of people have taken advantage of that, but not everyone. So now looking forward, so in the fall and in the winter particularly, this is when we know respiratory viruses, COVID-19, are expected to circulate in much higher numbers. And this is when many people get sick, and this is when the risk of getting infected increases. So that's why right now it's very important to have received all the doses that are recommended, and also to take measures to stay safe and to protect people around you as well. So right now our layers of protection are similar, slightly different. We're in a better place. We were able to lift the restrictions we had put in place before, which is good. We're coming back together safely. But we need to continue. And so I want to emphasize, and this is very important, that individually, we all continue to play a role. You know, I see people here wearing masks, keeping your distances when you're in crowds, not going out when you're sick. These kinds of things are extremely important. Washing your hands as well, very important. And so these things are measures, actions that people can take, continue to take, and people do, and we encourage that. We should continue to respect everyone's personal space. Some people have various medical conditions that put them at higher risk. It's important to respect that. Consider their particular situation before interacting with them. And I mentioned clean your hands and staying home when you're sick. That is very important. When you know you're sick, you don't want to bring the virus to others. Most importantly, of course, and it's critical, is to get vaccinated. And we have made many recommendations for the primary series, the booster, for some people a second booster, and now we're going to be talking about the fall booster. Vaccines and vaccination offer excellent protection against severe disease, and that's the path we're on, and we continue. We're taking the next step in the fall. So the National Advisory Committee on Immunization, NACI, is very strongly recommending that vulnerable people, so those 65 years and over, and people with medical conditions, receive a fall booster. NACI also recommends that all others between 12 and 64 receive a fall booster as well. So NACI is a group of experts from various backgrounds and expertise, working together, keeping a very close eye on the situation, on this pandemic, the epidemiology of the pandemic, on the vaccines that are available, keeping an eye on research, and on an ongoing basis, keeping track of all that to make sure that they can make the best recommendations to guide us, particularly with the vaccines, on how to manage this pandemic in the best way possible. So we have in BC followed very closely NACI's advice, and we continue to do so. And so this is no different at this time, and this is what their latest recommendations are about for the fall booster. So I want to talk a little bit more about also new vaccines that are more than likely coming to us. I think this is very important to know at this time, understanding what's coming for us in the fall. So after over a year and a half, maybe a little bit more than that even, we have now direct experience with COVID-19 vaccines around the world. So we've learned a lot. And so now we have a much deeper understanding also on how to make those vaccines to protect us against current strains, current viruses that are circulating. So what's important to know now is that the manufacturers have developed vaccines that will be better adapted to Omicron, which is great news. And this is what we're going to see more than likely. Things seem to go very well right now in terms of their assessment. They seem to be very promising. And The virus has evolved, as you know, over time. We have the original virus that started a while ago now, and then we had the alpha, the beta, the delta, and many others. And it has evolved, and our vaccines need to evolve as well, so that as the virus goes further out, away from the vaccine that we have now, we need to have a vaccine that actually is closer related to what circulates to be more effective. So these bivalent vaccines, and bivalent means two, it's going to contain the same as the ones we have now, the original virus, and the Omicron as well. It'll be able to be effective against those two strains. And they look very promising, like I said, but they still need approval by Health Canada. And so this is underway right now. So we have to wait for that. Like I said, it looks promising, but it's not done until we have confirmation. And NACI is also at the same time reviewing, and they will be making more specific recommendation, as they said in their latest statement, about the types of vaccines that would include the bivalent vaccines. The two brands that we are expecting for those vaccines are Pfizer and Moderna, brands that people know very well. So they're going to be mRNA vaccines as well. So we know that COVID-19 vaccinations are very highly effective, and booster doses are extremely important. We have recommended boosters now for quite a while. It helps bring your capacity to fight the virus back up again, but also extend so that it lasts longer. And so with boosters now we can actually be assured that we are very well protected for a much longer period of time. And so the boosters have actually helped us transition away from the crisis phase where we were a year and a half ago, and then we started using those vaccines and things were happening very fast, to a more stable, more long-term management of this pandemic. So those new vaccines and the boosters will be critical to help us maintain our trajectory, very positive trajectory so far in terms of managing this pandemic. Thank you. So now I would like to pass it on to Dr. Penny Ballem. She's the executive lead of the immunization program, and she will talk about how to operationalize all these approaches that I've just mentioned. Penny?
Thank you so much, Dr. Lavoie and Minister Dix, and welcome to everyone. It's a privilege to be here and just to talk to you about the new, evolving phases of our vaccine program. I thought what I would do, first of all, is just give you an update of where we are with results of our overall vaccine program. I think you know that we have, for our primary series, got really extraordinary results in our province, with 93.8% of our eligible public, 12 and older, having received their first dose. And 91.2% have received their second dose of vaccine. So this means that 91.2% of those who are eligible are actually fully vaccinated. And this is something, as Dr. Lavoie has referenced, is really a remarkable level of protection when we look at jurisdictions across the world. We started our first booster program, you'll remember, back in October. We started out with the most vulnerable first, and if you look at all the people eligible for vaccination, 59.5% of those have received their first booster. And if you look at the people that actually were fully vaccinated, it's actually, of all those, because you can't get a booster until you've had dose 2, it's up to about 66%. So 66% of the people that got their primary series have actually taken the opportunity of their first booster back through November, December, January, February, and they're still coming. But I just want to draw your attention. There's still 1.3 million people who haven't yet had that preliminary booster. That's very, very important, because that means that if they've only had dose 1 and dose 2, yes, they've got a good level of protection, but they're starting to get too far away from those doses, and they need to get that first booster. And we're ready for them at any time. And I just want to mention that some of them have wanted to try some of the newer vaccines, the Novavax. Some are interested in Medicago. And we are working hard to make those vaccines available. Novavax has been in the province now for a couple of months, and we are matching people up with our pharmacists around the province. If they want Novavax as their booster dose, we're trying to enable people to get what they want in order to get them that booster. So to the 1.3 million out there today, if you haven't had that first booster that we started back last fall, please go and get it from your local pharmacy or from one of your health authority clinics. And as Dr. Lavoie mentioned, we started what was called the Spring Booster Program that was, as NACI advised us, focused on more vulnerable groups and people over the age of 70. And at this point, of the people that were eligible for that, 64% have taken it up. And that's a reflection of, we know the older people and the people with conditions that immunosuppress them, they're keen. They really know they need protection. We know that the risk of COVID and poor outcomes is related to age primarily, and other conditions where your immune system is not active. So it's not surprising that we've had that level of uptake so soon. But again, there are still over 200,000 people who have received an invitation for this spring booster who haven't yet taken up that opportunity. And we really encourage those people, because they're the group that our advisors, our scientific advisors at the national level, NACI, has said, you need this protection. Before I go on to the next slide, I really just want to do a shout out for the pharmacy sector in the province and the health authorities who have worked together to support this campaign for the spring booster, and we'll be working together as we move into the fall booster. They've done a remarkable job. We have anywhere between 600 and 700 pharmacies every day offering vaccines everywhere in this province. And then for the health authorities, they're covering off the small children where people are not able to reach a pharmacy, to some of our more rural and isolated areas, working with the First Nations Health Authority to make sure our Indigenous communities are having access to the full range of immunization. So just a big thank you to them. It's been, they've been at that for a long time, and it's really great to see the results. So just a little bit more detail on the second booster campaign, our spring booster. As you remember, there were vulnerable groups that were identified, and this is just some data to show you that across those groups there has been good uptake. And I think we're very happy on the long-term care and assisted living residents that they were vigorously taking up on their spring booster, and that has made a big difference in that sector for just the number of cases of Omicron that we've seen. So as you can see, as our vaccine campaign has evolved, it gets more and more complicated. And by age, by vaccine, we now have gone from originally 2 vaccines that we were working with for the first year of the campaign. We now have 7 vaccines. We've got Moderna, Pfizer, we've got pediatric Pfizer, we've got Janssen, we've got Novavax, and we had AstraZeneca and Covishield. So this campaign has become more complex, and as the different age groups, we've had different vaccines developed for them. So if you look at people 12 and over in our province, they've been eligible for dose 1, dose 2. If they were clinically extremely vulnerable and immunosuppressed, the CEV 1 and 2 groups, they were eligible for a 3rd dose to get them fully vaccinated in their primary series. And then we have the 2 booster campaigns. The first booster campaign that covered everyone except for the 5 to 11-year-olds, and the spring booster number 2, that actually covered the vulnerable groups we've just talked about. For children 5 to 11, remember we started our campaign in very beginning of November. There was a lot of excitement that those children were going to have access. So again, they are now eligible for dose 1, dose 2, and for those younger children who also have compromising medical conditions that immunosuppress them, children with cancer, children with different kinds of autoimmune disease and immunodeficiency. They were eligible again for a third dose to complete their primary series. And now Health Canada and subsequently NACI will be looking at whether we advise that these children 5 to 11 will receive a booster dose. So that is still under consideration. At this point, children 5 to 11 are not eligible for any booster dose. And I think you know we're anticipating approval of a vaccine, a special formulation of a vaccine for children, the really small ones, 6 months to 4 years. And so that will essentially mean from 6 months on up, everybody in this province will be eligible for at least a primary series. So we're hoping that by the end of July, we will have the approval by Health Canada and NACI to commence that campaign. The health authorities will be delivering that campaign. For small children, they'll be merging it with their 5 to 11 clinics, and making provision for small children with different conditions that make vaccination not a great experience. So we're very conscious of making these clinics child-friendly for the whole range of small and larger children that we're actually taking care of. But we hope that by the beginning of August we'll have approval. We know the vaccine is here in the country, and so it's just the regulatory approval and then the review by NACI that will be happening, in the very near future. So, just turning now to, the fall. At this point, some minor adjustments that we're going to make to the spring booster campaign. As you know, I've reviewed this, that right now for people 12 and over, we're continuing to give them dose 1 and 2, and it's always interesting. I look at these reports every day to see, well, who's coming in for, a first and second dose or their first booster, and it ranges across all the ages. But we know that if you go down the ages, it's still the 70, the 80-year-olds and above, 60-year-olds. As we go to the older age groups, they are taking up the D3 and the dose 1 and 2, if they haven't already had it, at higher rates. And it's the younger people that we really need to encourage, and particularly to try and get them to come in for that first booster. We want them to come in because they need that protection as we move into the fall. But the groups that we have been vaccinating in the spring booster campaign are the very vulnerable, long-term care, assisted living, seniors 70 and over, our Indigenous peoples 55 and over, clinically extremely vulnerable who are immunosuppressed. And we've had, particularly from people in their late 60s, we get a number of calls every day, letters to Dr. Henry's office saying, I feel that I'm vulnerable. I'm now quite away, 6 months from my last dose, and I'd like to have a spring booster. And so what we're going to do is, allow people who feel they meet that sort of have unique circumstances. If they really want to have a spring booster, we will enable that. But the big message is, the recommendation is really the best thing to do is wait for the fall. That is what NACI has recommended. The reasons Dr. Lavoie has gone over. This is where we're most exposed to respiratory illness. We're moving indoors through the fall and the winter. Our risk is highest, and you want to get your booster when your risk is highest. And the group that were approved for the spring booster were much more vulnerable. So what we will do is allow people, we will be sending an update around to everyone 12 and over, and give them an update on NACI guidelines. We'll be doing this through the Get Vaccinated system. And what we will tell people is, it's all about the fall. We want you to wait to get your next booster in the fall. If you haven't had your first booster, go get it now. But if for your next booster, it's get it in the fall. But if you really feel that you've got special circumstances, you can give the call center a call, and we'll arrange for you to have a booster now. There are disadvantages to that. Dr. Lavoie has talked about the new vaccines that are coming. And, the interval, the minimum interval for your fall booster will be 6 months. So if you have a booster early than the fall, then you will have to wait for your full 6 months to get, access to the new vaccines or to a fall booster when we're providing it for the whole population. So best to wait and follow the advice of public health, but if you really feel you have special circumstances or you're very worried, we'll enable that. For the rest of the population, we will be commencing a campaign, and for us the fall will start at the beginning of September. And we have to be nimble if things change and take direction from public health, but right now our planning is focused on starting our fall campaign in September. It will be a campaign that will, as always, the priorities will be articulated by our public health leadership. And then our job in the vaccination program is to organize that so that we send out the invitations through the Get Vaccinated system according to those priorities. And we will be doing that as we have for all the other phases of this campaign starting in early September. And for the children 5 to 11, they will continue to get offered dose 1 and dose 2. And if there's a change in the recommendation for a booster from Health Canada in the coming weeks or months, then we will be opening that opportunity up to them at a 6-month interval. And as I said, for children 6 months to 4 years, we hope to be opening up their primary series for them, hopefully by early August. So, generally, in summary, NACI has strongly recommended that the fall is the best time to get your next shot. And that's to give us the best protection against respiratory season, the illnesses that move around. It's a time when our healthcare system is always challenged in the winter, traditionally with influenza and other respiratory viruses, and now with COVID in our life, COVID is added to that list. So that's when the risk is highest, and that's the strong recommendation of when we want you to get your fall booster. And, at this point in time, everyone will get invited come the fall. They'll get that invitation as they have for other things through the Get Vaccinated system. And, all our campaigns, as the Minister has said, will be done in order of priority. And for those who, as I mentioned, are going to want to get it early, we will be sending out invitations, not invitations, but our updates will go out to everyone, but they will go in the order, as we always do it, of those who are the oldest at the longest intervals will get their updates first, and those updates go out at about 40,000 a day, and so that will start rolling on Monday. So on Monday, we'll be sending an update telling everyone about the NACI guidelines, get your booster in the fall, but if you feel extremely susceptible at this point in time and you're not in the vulnerable group, then we will enable you to get an early booster through the call center. So finally, Dr. Lavoie has talked about this. Boosters benefit us in many ways. Essentially, it provides us longer protection. It stimulates an immune system that's already been set up by your early shots. It protects people who have a higher risk of illness and who have immune systems where the protection wanes more quickly, and that's mostly our elderly people, or if you have a condition where you're immunosuppressed. And generally, as we've seen, it's kept our communities safe. It's got us back to near normal. It's not completely normal, and it's allowed our hospitals to carry on dealing with things that are also very important. And so just a reminder on the golden rules, get all your recommended doses. My 1.3 million that are out there that haven't had their first booster, come on in, we're waiting for you. Follow the health guidelines, stay home if you're sick, wash your hands all the time. Respect people's personal space. We know that outdoors is safer, and that's why the summer is such a great time, and we usually do better in terms of respiratory illness because we're outdoors, enjoying the outdoors. Take into consideration other people's situation, elderly people in your circle of family and friends. And if you're going traveling, check before you travel and make sure that you're up to date on the guidelines and the advice that comes in from the federal government for travelers who are going out around the world. So thank you so much, Minister and Dr. Lavoie. And I'll turn it over to you, Minister.
Thank you very much, Dr. Lavoie and Dr. Ballem. I just want to say finally, again, strong and emphatic thank you to everyone in BC who has supported this effort in our province, to all the healthcare workers and healthcare professionals who have on the ground delivered our vaccination program, to Dr. Ballem and her team, her incredible team of both staff and volunteers who supported this program, people who have worked through the past year in the service industry and who came out and made the customer service of our vaccination campaign so outstanding. And I have to say, I have never seen, in terms of our surveys of people who received the vaccines, so much public support for the delivery of those vaccines. I mean, getting a shot, I take a few every day because I have type 1 diabetes, but getting a shot is not a fun thing, but it is an important thing. And people have different reactions in different circumstances. I think our team has done a fantastic job. I want to speak just to the people who have followed our guidance and got the vaccines when they've been asked to get them, when they've been invited. The 2.8 million people who've got their first booster, their third dose, and that 2.8 million people are obviously strong supporters of the vaccination campaign, and we are very appreciative to them. The message to them today, except for those who are 70 and above and those who are in clinically vulnerable 1 and 2 categories who have immune issues, is that a fall booster campaign is coming, and that's the best time to get it. But we also respect you and your judgment. And so we will be contacting you. You've got to wait till we contact you over the next few weeks, as Dr. Ballem said. And if you feel like you need to get a booster now, one will be made available. And I want to say to everyone in that group, thank you. So that 1.3 million people who've got their 2 doses are eligible for their 3rd dose and haven't got it yet, it's time. This is a really good time. As we see circumstances here and around the world, an important time. And as Dr. Ballem says, we're here and ready for you. And thank you for getting the 2 doses. This is a good time to get your first booster dose. And those people who haven't got their first dose yet of a COVID-19 vaccine, it's 6% of the population in BC. It's about 1 in 16 or 1 in 17 people. There is never a better day than today to get vaccinated for the first time. And I want to say that we will welcome you, and every day, it's not because we've been doing this for some time, a large number, but every day some people come in for their first dose, and we want to express our appreciation and our support to all of them. And thank you in advance for getting those doses. We are working hard to ensure that this outstanding vaccination program that serves people in every community in BC, from Indigenous communities and our partnership with the First Nations Health Authority, to communities in every health authority, that we are going to continue. And it's a major challenge in the fall, but we are going to continue to deliver our vaccination program to you, to respect and honor and celebrate everyone in BC, and to do what we've done from the beginning of this pandemic, which is to work together, all of us, to ensure that to reduce the impact of COVID-19 on ourselves, on our neighbors, on our friends, on our communities. It's very important to protect our healthcare system and allow us to do, in the midst of a pandemic, all the things that we hope and dream and aspire to do. So thank you very much, and we'll be happy to take your questions, Dr. Ballem, Dr. Lavoie, and myself.
Thank you to all our speakers. A reminder for media on the phone, please press *1 to enter the queue. That's *1 to ask a question. Please also remember to take your phone off mute. You will not be audible until your name is called. For media in the room, please line up at the microphone provided and wait to be called. Please make sure to provide your full name and outlet. Media will be limited to 1 question and 1 follow-up. For our first question today, we'll be starting in the room. Please go ahead.
Hi, Cole Schisler, Black Press Media.
Hi, Cole.
Hello. So with BA.5 being the dominant strain right now, what is the risk of infection to people and reinfection, and what's the immune escape of that variant?
So you'll understand that I'm going to turn that question over to Dr. Lavoie.
Hi, good question. So as we've seen already with Omicron, the first one, BA1 and BA2, we will see infections. The risk of reinfection with Omicron is higher than it used to be before Omicron. But usually, typically what we would see is a less severe infection. So it is not impossible to potentially even have 2 Omicron infections, but it's more something that we would see with something before Omicron and now getting infected with Omicron. So what we are seeing right now is it's Omicron overall since the winter, and we went from one of the siblings, I call them siblings, they're related, Omicron BA1, replaced by BA2, now being replaced by BA5. It's not quite the majority, BA5 at the moment, but we are seeing the replacement. So BA2 is going down and BA5 is going up. So we expect to continue to see that same pattern, and which will, as I said, we expect to see fluctuations in the number of cases, number of people having to go to a hospital because of it, and we will probably see some of that. But right now, with the vaccine that people have, if they have received all the recommended doses, people are very well protected. And what is driving severe cases mostly is really people, unfortunately, advanced age 80 plus, to some extent also 70 to 79, and as we've mentioned a few times, people with immune system issues. So to be protected, well, you need to have an immune system that works well, and there's only so much we can do when the immune system is significantly affected.
Did you have a follow-up?
Yeah, so we're seeing cases go up right now today. The BC COVID-19 modeling group says we are on the cusp of a 3rd Omicron wave that's likely to peak in August, but we're not getting the 4th shots until September. What proactive protective measures could the province take today to stave off this incoming Omicron wave?
Well, if we remember, we just went through BA2, which was quote-unquote a wave, so a second period of Omicron, different sibling, and we did quite well. I mean, like I said earlier, it's not perfect. We do see cases, and where we are now, and people having received all the recommended doses, is the best thing that we have. We are in a much better place now than we were many months ago. So we're already in a good place. We continue to recommend receiving all the doses that you should be receiving for your situation, and we know that people who have done that are well protected now for the next number of months, and that's why, and NACI has looked at that very carefully, and that's why the recommendation for the fall booster is in the fall.
Our next question will stay in the room. Please go ahead.
Hi, Aaron MacArthur, Global News. Dr. Ballem, you were talking about the disadvantages to boosting early in preparation for a risky fall, considering that we're in the middle of a wave or the start of a 3rd wave of Omicron. Are there risks to not boosting now to protect those people, and is there a tipping point where that spring booster becomes a more widespread phenomenon?
That's a good question. So there are many factors that we need to consider. So one, we need to be reassured that with people having received all the recommended doses, we're in a good place. And so when we're talking, we just have to remind ourselves that it's very specific groups that are actually suffering more severe illness. And these groups, and we have actually recommended a second booster for these groups in particular, but even with that, it's not perfect because they only have so much immune system to go with. And so there is a limit to what we can do. So if we were to immunize everybody else, that wouldn't make any difference to these people in terms of their capacity to prevent a severe disease.
Follow-up? Minister, you were talking about vaccinations and rates of vaccination and the first dose, but there's clearly 1.3 million people who haven't gotten the 3rd dose. There's clearly a segment of the population that won't be vaccinated. And if vaccines, as you say, are so important to this, with such a large group that won't go down that road, can the province reinstate some of the measures that were in place during the more severe portions of COVID, masks, for example? And what would it take to go back down those roads?
I think that we've seen multiple steps taken at different times in the pandemic, and it's important to remember that at different times in the pandemic, for example, in long-term care, we've taken very different approaches to visitation. Our focus on visitation now, understanding its importance, right? The importance of visitation to the lives of people in long-term care, is to, as much as we possibly can, enable it. In other words, you have to be vaccinated, right? You have to have done a rapid test and go through that to keep people maximum protected. That doesn't eliminate all risk, but it eliminates some. So our strategy has changed and will consistently change over time. And so we can't predict, of course, what's going to happen in the fall. But I am more optimistic than you. The 1.3 million people we're talking about who haven't received their booster dose or their third dose, who are eligible because they've received their first two or primary series dose. Clearly, that's a group of people that supports vaccination. How do we know that? We know because they've got 2 doses. And so I think the message to them, in terms of keeping themselves and the community safer, is to get vaccinated. And every day, that category, slowly but significantly, in the thousands, moves up, right? Equally, for people who need a 4th dose, who are eligible for a 4th dose, because that number, well, relatively high, there's still a significant number of people in the hundreds of thousands who are eligible for a 4th dose who haven't received it yet. So to encourage them to get that and to enable that. Right? Today we said that people who receive the 3rd dose, who are at 182 days, will, if they want to, be able to get a 4th dose. But I would say that we're still in a pandemic, and that means we still have to be cautious. And it has an impact every day. And there is no day when I hear of someone who has had severe health outcomes from COVID-19, including death, that we don't grieve for them. And so as a community, we've adapted, and we've adapted, and we've adapted. And we're going to have to continue to adapt to the circumstances in front of us. And right now, the focus of this effort should be on those who've been invited to get a dose, get their dose of a COVID-19 vaccine. It makes us all protected. And we're going to continue to consider all of the measures that need to be taken at all times to keep people safe, understanding that those have an impact. Right? One of the things that people in BC should be proudest of is that we kept schools open. It wasn't easy. And it reflects, I think, exceptional work by people in the education system, people in public health. It wasn't easy, but we did it. And people had months of school in person that the people living in every other province in Canada, or most other provinces in Canada, didn't have. Right? And that has public health and community benefits that are incalculable. If you have children, you know this, we know this, that when you cancel school, it has health impacts and impacts on them and their lives. So we have to balance these things all the time. And in BC, we've made the decision to take the leadership of people such as Dr. Henry, such as Dr. Lavoie, such as Dr. Gustafson, such as Dr. Ballem, to lead our campaign and provide us with that guidance. And I am very proud to speak all the time in solidarity with them. And they are on this every single day. We review these things every single day to try and keep people safe. We're going to continue to do that. And as circumstances change, those circumstances will be judged. But every action has consequences for people's health, and for the society, and we're going to continue to act based on all the evidence and follow direction with respect to COVID-19 and public health.
For our next question, we're actually going to go to the phones. We'll come back to the room in a moment. Our first question on the phones is for Rob Monroe, Info News. Please go ahead.
Hi, Rob.
Hi, Adrian. Thanks for doing this. The vaccination rate in the interior is lower than about 5% lower in all categories than the provincial average. I'm just wondering what you're doing about that, and also all these severe cases of hospitalization and death. We talk about the elderly, but how many unvaccinated people are getting very ill as well? And so it's a message to send to them that maybe they should be getting vaccinated.
Well, I think I heard the question. It was a little muffled, Rob, but I'm going to give it a go. In general, the rates of vaccination in BC in areas where there are apples to apples are higher than other jurisdictions in Canada, although they're all good. They're all good, and everyone's done a good job. So the 94% of dose 1 is high, higher than the Canadian average, and high in general, and for second doses as well. And depending on availability, the fourth dose is a little different than that, but we've done pretty well, and that reflects, I think, the excellent campaign we have, the the really customer-friendly campaign we've had, if I may say, and the outstanding work of our healthcare professionals and healthcare workers. So our task is to continue to communicate the need for vaccination and the need when you're invited to be vaccinated based on the best advice of public health to get vaccinated, and for us to do everything we can to make that easy. And that's what we're going to continue to do. As are other jurisdictions in Canada, we work together and meet on this regularly. And look, there are going to be new challenges ahead, and we're going to meet those challenges. I mean, we're going to have, as Dr. Lavoie and Dr. Ballem have said, potentially new vaccines approved by Health Canada soon, or at least adaptations of the current vaccine that will provide better response against Omicron variants of concern. And that will require another huge effort on our part. And a fall vaccination campaign involving millions of people will require a huge effort on our part. It's based on the best evidence that we're going that route, based on what we've been told by the NACI. We're going to do our best to continue to communicate with people, including parents of children, 5 to 11, for example, and others who may soon become eligible for younger children who may soon become eligible for a COVID-19 vaccine.
Rob, did you have a follow-up?
Yes, I don't think you quite did hear me. What I'm asking is, how many of the people that are getting severely ill are unvaccinated, and what impact does that have on the Interior Health region, which has a lower vaccination rate? Is that causing a greater spread here, greater risk?
Basically, the risk of hospitalization is 5 times lower if you're vaccinated, and the risk of mortality is 8 times lower. That's the evidence. And so in Interior Health, it does have an impact for a number of reasons. It has an impact in the following ways. That overall areas where the rate of transmission of COVID-19 is higher, and at the moment that's Interior Health, Vancouver Island Health, and Northern Health, also by definition will have the highest rates of healthcare workers absent due to illness, because when you're sick, with COVID-19, you don't go to work. And so that has an impact on the delivery of services, especially in some small communities. So if you only have 3 people working a shift in a small community and 2 get sick, well, that affects your ability to deliver the service. And so you see this on a particular day from time to time. So it has an impact there. And so the argument simply is to encourage people in Interior Health and Northern Health, for example, is to get vaccinated. And they have in their overwhelming majorities. So the differences between some of these regions, well, it may be higher in Vancouver, in Metro Vancouver, and the Metro Vancouver Health Authorities. It's only a few percentage points higher. But we need to encourage and continue to encourage people to stay safe. And then as the fall boosters come, we need to do this again and to ensure people stay safe during, as safe as possible during respiratory illness season.
For our next question, we're going to Moira Winton, the Tyee. Please go ahead.
Hi, good afternoon. Thank you for taking my question. For Dr. Lavoie, you mentioned the limits of vaccinations, particularly for...
Moira, I think if you're on speaker, if you come off that, because we're having... you're quite low, and it may be a problem at our end, but if you can speak directly on the phone, I'd appreciate that so I can hear you clearly.
Is that better?
That's better. Thank you, eh?
Okay, thank you. I'm on our landline because my cell is out. Dr. Lavoie, you mentioned the limits of vaccination, particularly for the most elderly and vulnerable. So what could be done today to reduce circulation and transmission of the virus itself in order to prevent death and permanent damage like long COVID?
Yes, thank you for your question. So the idea is to try to kind of maximize all the things that we can do, and so that includes the vaccines, obviously. So for those who have received all the recommended doses, in essence, we're pretty much maxed out in terms of what we can accomplish there. The zones, the areas where we could actually increase our protection is for those who have not received all those doses. So we've mentioned that. We know also that, and I've mentioned that earlier, but individually we all play a role. We did, of course, as Minister mentioned, if we need to reinstate measures, we will need to look at that. We keep our eyes on that. We're not there yet. But individually we can make also a big difference, and there's so many things that people can do every day to reduce the risk of transmission. And so it's a number of different things, and what's coming, because we also want to have a vaccine that's adapted to Omicron, because right now the vaccine we have is not adapted. It does make a difference, but it's going to be better to have that vaccine, and so that's coming. And so we have all these things that we're trying to balance, and just if you think back just a number of weeks ago, we were going through Omicron BA2, and so people are taking some measures, and we continue to immunize people and give them vaccine doses that are recommended, and Penny mentioned that, and so that's what we continue to do.
Moira, did you have a follow-up?
Yes, I do. Thank you. NACI, I know we're following the NACI recommendations quite closely, and NACI does say that a second booster may be offered to anyone over 6 months after their last dose. So what is the risk analysis being done that says waiting for a more tailored vaccine or bivalent vaccine is going to have a bigger effect than giving the non-tailored vaccine now, given that we are seeing already an increase in BA5 and hospitalization?
Yeah, so when NACI look at things and come up with recommendations that say, it's kind of looking at, depending on the situation, you may consider offering this. Well, the situation is right now is that we have Omicron, and the vaccine that we have is not adapted to that. And so it's based on the risk, but also the difference we can make with the tools that we have. And so using the same vaccine with people who are already well protected, and that's something else we keep our eyes on, is how well are people protected with all the recommended doses. For most people, it's primary series and their booster, and they are still very well protected. And so that's in that sense that NACI is making those recommendations, because what we don't know, and what NACI knows that can happen, is we can have another completely different variant of concern that shows up, or maybe one that we have seen already that comes back potentially. And so it just depends on, it's depending on the situation, and we need to look at that, what happens in Canada, in BC, and then use the tools and all the measures we have at our disposal in the best way possible. So that's what we have done at this, up to this point.
For our next question, we're going to Zhao Zhu, Globe and Mail. Please go ahead.
Hi, Minister Dix. According to federal government data, BC's uptake of the second booster shot is currently lower than most provinces across the country. Could you please explain why other jurisdictions are ahead of us?
So, very straightforwardly, within the categories that are recommended strongly by the NACI, as people over 70 and people with immune issues. So that 100,000 people or 96,000 people in the ZEV 1 and 2 categories, that's not the case. The take-up has been higher. We have had a less broad offer of the second booster dose so far. So other jurisdictions have offered it with some of the same advice that we're giving today, with the same advice, but offered to a broader group in the population. And that's the reason why on the fourth dose booster they'd be higher.
And did you have a follow-up?
Thanks. Yes, I do. Prior to today's announcement, infectious disease experts said the messaging for people to get booster shots have not been forceful and clear enough in BC. That's including the third shot. So what's your thoughts on that?
How can I be more clear than I have been, I would say, and I just say this delicately, the last 150 times I've said this. If you've been invited for your first booster, get your first booster today. Sign up for the appointment today. It'll make you safer, it'll make your family safer, it'll make your community safer. Get it done today. And if you've been invited for a second booster and you're in those categories, get it done today. Book the appointment today. We have had, and we've consistently had capacity to address it. So, and people are responding to this, I should say. I mean, we've been doing about 50,000 shots a week overwhelmingly through a community pharmacy in the last number of weeks, and we continue to do so. But there was a lot of urgency, you'll remember, in December and January and February and March, and we certainly made the case, and there was urgency, and people went and got their third boosters. 2.8 million of them have have received their third shot, their first booster. And so I think we got to continue to push that message in every jurisdiction in Canada, because in terms of the third shot, or the first booster, we might call it that, that was started to be made available in October and November and December, the numbers are pretty consistent across the country, so we face some of the same challenges, but I can't be clearer. Get the booster. If you've been invited, as you have been now, in most cases for months and months and months and months, get the booster. And I just want to give you my personal experience, if you will, just to say what the circumstances are. I got my first COVID-19 vaccine in the middle of April 2021. I was about the 1.5 millionth person to get it, so I wasn't at the front of the line, I was sort of towards the middle. 1.5 million people had received it before I did. And then I got my second COVID-19 vaccine at the strong encouragement of Dr. Ballem in the middle of July, right? Consistent with when other people got it. So if I had not in January got my third shot, that was the second shot, the third shot in the middle of January, it would be next week 1 year since I've had a COVID-19 vaccine. So I strongly encourage you in the strongest possible way, if people have not received their booster dose, their first booster dose, their third dose, if you're in that 1.3 million people, to book an appointment today, please do so, or just do so.
For our next question, we're coming back to the room. Please go ahead.
Ballem Mendoza, CBC.
Bonjour.
Would you consider bringing back some of public health restrictions if the COVID situation worsens in BC, and if so, which ones would be implemented first? And could we get an answer in French as well?
First of all, I want to say it's a very, very good day for CBC and Radio-Canada, because Dr. Lavoie will be here to give the answer in French, which is, I think, having listened to me for some months, the people at Radio-Canada will particularly appreciate. You know, we monitor COVID-19 every day, and it's the strong view of public health at the moment that people need to get up to date with their vaccinations, and that's the key priority for us. That we've got to continue to manage in our public health care system, and it has implications for us, the impact of COVID-19. That people have to be careful in their lives, and we talked about the golden rules before, but when I go to indoor public spaces, when I shop at Save On Foods on Marine Way or on Safeway at Kingsway and Tyne, I wear a mask. And people don't need me to tell them to wear a mask, to stay safer. And if you're visiting with a large number of people you don't know, you can wear a mask. All of these circumstances are available to people right now, and they can do so. One of the things that I'm proudest of in BC is that we are the first province to bring in paid sick leave, right, by legislation and by my colleague, the Minister of Labour, Harry Bains, which allows more people to stay home when they're sick and not face financial consequences from that. So if you're sick, stay home. And that's not just true, by the way, of COVID-19. And so I think that we just got to continue to monitor, to stay on top of, to ensure that vaccination takes place, and to learn more and more about COVID-19 every day. And one of the things I am most impressed by Dr. Lavoie and by Dr. Henry and by Dr. Gustafson and all of our, Dr. Daly, all our team around BC in the different health authorities, is their willingness to learn and their willingness to engage with people on the ground. The work that's been done in communities such as the downtown east side, for example, by Coastal Health, and the high vaccination rates in sometimes very challenging circumstances is a tribute to how much that staff has been on the ground and working with people. We're going to continue to do that, continue to learn, and the advice has changed a number of times. People have told me this a number of times, that the advice had changed. It will change, of course, again. We'll adjust again and adapt to the circumstances. Not for me to speculate what that might be in future, but you know that we're taking care of that every day.
And did you have a follow-up?
En français, bien entendu.
Oui, bonjour. On ne peut pas prédire exactement quelle sorte de mesures on va mettre en vigueur, parce que, comme je disais tantôt, on regarde et on garde notre œil sur plein de facteurs. Puis on sait aussi que les mesures qu'on a mises en place dans la dernière année en particulier, ils ont joué un rôle dans un certain contexte. Le contexte a beaucoup changé. Donc, ce que je veux pas faire, c'est d'essayer de prédire quel facteur, la situation va changer de quelle façon, ce qui va nous indiquer qu'on devrait instaurer telle ou telle mesure, parce que là, c'est un peu trop de prédiction. Mais on regarde ce qui se passe au point de vue de la pandémie, de quelle façon ça se distribue, les gens qui sont les plus affectés, puis on va mettre en place les mesures qui sont les plus appropriées. Donc, c'est sûr que le port du masque, c'est une mesure qui est facile, mais quand on instaure des mesures très strictes à grande échelle, ça a des impacts négatifs aussi qu'on doit considérer. Donc, on doit mettre tout ça dans la balance et on regarde ça de très près. On essaie de ne pas instaurer une mesure restrictive si on n'a pas besoin de le faire. On a été avec des restrictions pendant très longtemps. Ça a été très pénible, ça a été très difficile. Les gens ont bien participé, mais on va le faire si on a besoin de le faire. Ça va dépendre de la situation.
Thank you, everyone. That's all the time we have for today. Thank you, everyone, for joining.